This is the Emergency Medical Minute.
So I just got back this morning at 1 a.m. from a trip to Yosemite. We did a big climbing trip and we climbed this wall called El Capitan. And so on this wall in particular, one of the major problems is the ability to bring up enough water, because the problem is you have to carry the water up and haul it, and that's tremendously it takes a lot of calories and effort to haul a bunch of water. And so I had a lot of time to think about water, and so I thought we could do our medical minute on dehydration and problems with hydration in the wilderness medicine arena. And so there's essentially two problems with water when you're doing endurance events or in the backcountry. And one is that you overhydrate, and that's actually fairly common issue, especially in places like the Grand Canyon, or they have these desert marathon and ultra marathon race series. And so athletes may overhydrate and consequently become hyponatremic. So if you can imagine that you're taking in way too much free water, you dilute the sodium or the salt in your blood, and your sodium level is too low. That's called too low, natremia, sodium. That makes you quite sick, and honestly the symptoms, you feel dehydrated, you feel dizzy and lightheaded and unwell, and a lot of people mistake that for dehydration, and then you continue to drink more free water, and this can lead to some pretty serious problems, and there have been case reports of deaths actually. Eventually, when your sodium goes low enough, and you may have had patients with this, you have a seizure, coma, death type of pathway. And so hyponatremia is a real risk. Hypernatremia, so hyper meaning too high sodium, is also a common problem with endurance events, and that's generally from dehydration and inadequate fluid intake, and that's probably actually a little more common. Again, the issue is the symptoms are really hard to distinguish based on just what you're feeling, because it feels pretty similar, and if you don't have a sodium measurement device in the field, it's difficult to tell how to treat. So that's all I have, and I can send you the article. There's a wilderness medicine review article if you're interested. Thanks.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.